There's a problem that I see so commonly in both men and women, a little bit more in women because they tend to be on some of the medications that worsen the problem. But if you feel sick, if you feel tired, if you feel achy, if you have frequent urinary tract infections, if you're bloated or have difficulty losing weight, if you have things like IBS, even menstrual problems, acne, low immune system, chronic sinus infections, feel sick often, get sick often, there's a good chance that the root of the problem may actually be an imbalance in your gut, which is candida. Candida is an overgrowth of fungus in our body, and that can truly wreak havoc on our system. It can really masquerade as any illness, and many times patients are misdiagnosed with other issues when the true underlying problem is candida. So if you have some of these issues, chronic sinus problems, chronic UTIs, we see prostatitis in men, and then they're mistreated with frequent antibiotics, but the actual problem was fungus. Again, prostatitis, frequent UTIs, chronic sinusitis, fatigue, fibromyalgia, any gastrointestinal issues, even chronic infections like that may be diagnosed as Lyme disease. What can actually be the problem is candida. And to diagnose and treat that is really an art. So you have to make sure that you go to someone who is really, really well versed, because you can get the treatment and not get better. There's a lot that goes into it. But if you have been on antibiotics a few times in your life, especially if you've been on antibiotics 5 or more times in your life, if you have been on birth control pills in your life, synthetic medications, anti-inflammatories like Advil, NSAIDs, or steroids, there's a very, very good chance that you can have candida. And also, stress in life increases candida, and things like food intake and even poor water intake. But the big culprits are antibiotics and things like birth control pills, which can increase this problem, and it will manifest as the problems we talked about. So if you have these issues, it's a very, very good idea that you look deep with somebody who is well versed in this and try to identify the root of the problem, because it can masquerade as many, many other illnesses, and you could be misdiagnosed and actually mistreated with so-called treatments that will actually worsen your underlying problem. So candida, huge. If you feel ill, if you have some of these symptoms that I talked about, very, very important that you keep candida on your mind, even if your practitioner may not. You can study about it, reach out to a physician who is well versed in it, and get it taken care of.